hemiplegic gait is seen in patients who went through a stroke. The stroke is the damage of the brain on one side, mostly the frontal lobe, that's causing the damage of the motor functions. So whatever side of the brain is damaged, usually the opposite side of the body going to the paralysis. We call it hemiplegia, that causing the hemiplegic gait. What these patients do, the position they have, mostly the flexors of the upper limb are tight, so they are like in this position. Let's say if the right side is hemiplegic. And then the extensors of the lower limb are paralyzed. So what they do, they are like this position, and then the knees, they cannot flex the knee because extensors are tight. So they are in this position in normal standing, but while you ask them to walk, what they do is, because they cannot flex the knee, they move the leg in a circle position and then just go to the next step. So what they do, technically they do this position. If you see the patient like this position, like this, with this gait, this is a typical gait of hemiplegia. That is the gait that is, you can right away say this person went through the stroke. And even can say what side of the brain is damaged. Usually it's the opposite side of the side is you see the paralysis. The other side, if you notice, if you put if you block this side of the body, you don't look at it, the other side totally has the normal swing and normal walk. This walk is called hemiplegic gait.